Top of the morning, Dan and Amy, and wanted to tackle an issue that Tucker Carlson tackled. I had seen some of these videos online, but he got the epicenter nurse in question. This nurse, Erin Olszewski, was at Elmhurst Hospital in Manhattan for a month during the height of the outbreak in New York City.
That's the place where, remember, there are long lines to get into?
Yeah, the issue is about commingling the COVID-19 infected with the not COVID-19 infected. And she did a little bit of undercover video work because she couldn't believe what was happening. By asking questions, she was sent home, and she didn't think anybody'd believe her unless she had video evidence.
This patient is in with like a non-COVID. I don't understand why they're doing that.
I know. There's 4 patients in a row here
Yeah.
non-COVID. And this is supposed to be the COVID.
Yeah.
Because 7th floor, they shut it down.
That's right. I'm confused.
And then they're going to have non-COVIDs there.
Yeah.
This is going to be the only COVID, so they shouldn't put any non-COVIDs here.
Well, that's what they've been doing. The guy over in 29, I had him upstairs because I was on CCU before it.
Yeah.
And he came in with a stroke.
I know, that's what 26-1 was, a stroke.
And no COVID. And now he's got COVID, and he's on a vent.
Well, because we gave it to him here.
That's because we gave it to him here. That's the undercover video that she explained on Tucker Carlson last night.
Well, this was a pretty common occurrence, and the video shows COVID and non-COVID being housed in the same floor, sometimes in the same rooms, which is ultimately creating, hospital-acquired infections of COVID. It's nosocomial infections. So, people will be admitted without COVID, and they will end up getting COVID. Sometimes they'll be awaiting their tests, which would take anywhere from 5 to 10 days to see if they had COVID and be admitted to these floors while they waited.
And another important point that she makes as a nurse, she was the advocate for the patient because no family was allowed in, so no family was present to advocate on behalf of their relatives for what was happening.
That's what I'm having a really hard time with, because nurses, we're supposed to be reporting, anything that we see unethical. It's part of our job. And
yes.
Without family in the rooms, we are the patient's eyes, ears, and everything. We have to make sure that the patients are being treated properly. Anybody and any nurse or anyone that would question anything would be sent home. I was one of them. And nobody ever wanted any of this out. And it's all hearsay if you don't have proof. So I needed to get the proof. So because it is so absolutely unbelievable that without it, people couldn't even fathom this.
The Wall Street Journal talked to nearly 90 frontline doctors, nurses, healthcare workers, hospital administrators, and government officials, reviewed emails, legal documents, and memos to analyze what went wrong in New York. Among the missteps they identify, improper patient transfers, too sick to have been transferred between hospitals. Squabbling between the Cuomo and de Blasio administrations contributed to an uncoordinated effort. And also, per Nurse Olszewski, insufficient isolation protocols. Hospitals often mixed infected patients with the uninfected early on, and the virus spread to non-COVID-19 units. It wasn't just the nursing homes in New York City and New York State. And then there are other criticisms of the response detailed in this extensive piece in the Wall Street Journal that's worth a read. But, it's just remarkable, and you rely on whistleblowers like that nurse, and you rely on investigative reporters like those at the Wall Street Journal, because otherwise all you get is Chris Cuomo and his brother playing grab ass on CNN about what a great job they're doing together. It's just this story. This just gets worse and worse. And that doesn't even get us to the public health professionals playing politics over the last 2 weeks, which we now turn to with Dr. Sally Satel. She is a resident scholar at the American Enterprise Institute, visiting professor in the Department of Psychiatry at Columbia University's Irving Medical Center. Dr. Satel, thanks so much for joining us. Appreciate it.
Thank you.
So before we get to the politicization of public health professionals, what about these stories? Whistleblower has her story and video evidence to support it, and then this Wall Street Journal deep dig about the New York City and state response as the media is otherwise lionizing Andrew Cuomo.
Well, uh, obviously, unfortunately, there's all so many levels on which this pandemic is being politicized, and that's one of them. And you really thank goodness for cell phones for that kind of proof, because without documentation, it's really very difficult to make the case, or without the kind of rigorous investigative journalism that, as a sidelight, we're losing. I mean, the Wall Street Journal is a major newspaper, so they have the funds, but on the local level, we're losing that kind of thing. So you can imagine what goes on in what could be going on, I should say, in smaller hospitals all over the country, and we're not getting that news. Now, of course, we have to add that the majority of staff or doctors and nurses are working themselves to the bone, and they're honest and they have integrity. But unfortunately, you can have an administrator in a hospital who wants to protect things, wants things to conform to a certain narrative, and for every 100, 250, straightforward, hardworking practitioners, there could be an administrator who wants to shape things, and it gets terribly distorted, and worse, people die.
Well, and don't you think Elmhurst Hospital isn't the only one that commingled COVID positive with regular patients?
Well, I'm not there. I don't know that. But when you see a phenomenon in one place, I would be skeptical that it would be isolated. How widespread it is, I don't know. But again, it's thank goodness we have that kind of this kind of proof, because as I said before, it's probably not being uncovered in some place.
I know you don't do impressions. Your field is in the training of psychiatry, but give me your impression of public health professionals' opinions during the civil unrest of the last 2 weeks. Epidemiologists and other public health professionals suggesting that it was okay for protesters to protest because, for example, and this is an argument that was literally made, white supremacy is a contributor to COVID-19 spread.
Well, there really are almost two issues here, and one is a double standard. But you can imagine that if this were a rally for a cause that progressives did not approve of, let's say a Trump rally or a pro-life rally or an equal pay a rally for women, something like that. Well, let me back up. I think people are in favor of equal pay, but if this were a march that was for an issue that was important to people on the right side of the spectrum, I don't think, in fact, I'm quite positive, we wouldn't be reading points like this. For example, a senior epidemiologist at Johns Hopkins tweeted, "In this moment, the public health risks of not protesting to demand an end to systemic racism greatly exceed the harms of the virus." Well, systemic racism is a big problem, but it is not the point of public health to tell us whether risks are worth taking. Their job is to tell us, based on objective measures, what the risks of exposure are. And to me, this belies a very pernicious mission creep that's been part of public health for quite a while. In fact, in 2000, I wrote a book called PCMD, How Political Correctness is Corrupting Medicine. And, and this has been a theme in public health, and especially academic public health, but also on the ground for quite a while. And the idea is that essentially they're injecting their social values into risk assessment. And to me, it doesn't matter which direction their social values go in. They could be, for example, saying that Black Lives Matter march was too risky, but an anti-abortion rally was fine. That's not acceptable either. They tell us the risks, and individuals make decisions based on that. They weigh what's important to them versus the risks. And also in the case of COVID, when it's infectious and it's truly a public health matter, then of course officials have to weigh in too. And that's why we've seen government officials, they're making judgment about lockdowns. They're weighing the complex dynamics of so many things, infectious spread, the consequences of the lockdown, the economic devastation, the social isolation that's so distressing to so many, and the needs of their citizens and cities and states. These are complicated things, and values do come into play there. They come into play, again, at the level of the governors and mayors and individuals, but they should not come in at the level of the public health officials. They're supposed to be the objective party in this assessment of risk.
Dr. Stanley Goldfarb, former Associate Dean of Curriculum at the University of Pennsylvania's Perelman School of Medicine, had an op-ed in the Wall Street Journal 2 months ago at the height of the outbreak. And he talked about the need for medical schools to be reformed. Above all, the medical profession should abandon the fantasy that physicians can be trained to solve the problems of poverty, food insecurity, and racism. They have no clinical tools with which to address these issues. The public may not realize that well-funded organizations advocate for devoting a substantial part of medical school teaching to teaching social and organizational topics, and rather than taking like a course on, what to do in a pandemic, for example. So Goldfarb was exposing this too as somebody who was in charge of curriculum at a prominent medical school. And I don't think people have an appreciation for that and how that sort of politicization of medical schools will result in, frankly, better quality doctors.
Well, that was the topic of my book way back then.
Yeah.
I agree 100% with Dr. Goldfarb. At the very least, it's a massive distraction from what physicians should be doing. And at the worst, it harms credibility because if people see that the choices that doctors and public health people make in terms of what they value is shot through with their own personal values, which they're entitled to have as citizens, of course, and protest as citizens. But if they see that their advice is becoming distorted by ideology, what happens when the next pandemic comes?
Well,
and this one, frankly, isn't resolved yet, and we have to know who to trust.
Well, absolutely. And here's the other thing, though, too, and this is the medical profession as well as every other sector. Who will stand up to the mob? Who will take on the purgers? And by that, I mean people like this. A Black Lives Matter acolyte who tweeted the other day, when you expose a racist student, you stop them from attending a university. That will allow them to become a racist healthcare worker, teacher, lawyer, real estate developer, politician, etc. So, this necessarily includes not just the university, but also the med school. You have to have teaching physicians, and you have to have doctors and nurses and healthcare professionals and public health professionals be willing to stand up to the mob. And we're going to see. We're going to see if they're willing to do that, because in some of the fields of medicine, it's clear they're part of the mob.
Well, it is true that mob rule, science by mob rule, and health by mob rule, which is a terrifying thing. I am hoping that we're in the midst of a real, frankly, I'm just calling it a moral panic right now. It's all so raw. The death, of course, of George Floyd was horrific, and I'm hoping that this will fade a bit. Believe me, it won't fade completely at all. I do think we're entering a much heightened phase of what I call PCMD, but that's one thing I am hoping. And second thing, well, I'll keep writing, and so will Dr. Goldfarb, I know. And I also know a lot of deans who really are impatient with this. Unfortunately now, as you say, there's almost a purity test people have to go through now. But my question to my colleagues is, what more can they do than serve their underserved, whether they're frankly black or white, but patients as best they can? And to be honest, we are not doing as good a job. There's no question about that. So I think there's lots of room for improvement, but I don't think it should be based on a purity test about how you see our nation in terms of racism one way or the other. It's whether you're devoted to your patients, and we allocate, quality services to people in neighborhoods that are underserved.
She is Dr. Sally Satel. She's a resident scholar at the American Enterprise Institute, visiting professor in the Department of Psychiatry at Columbia University's Irving Medical Center. Dr. Satel, thanks for joining us. Appreciate it.
Oh, thank you.
And she joined us on our turnkey.pro answer line.
If you're talking about it, Dan and Amy are talking about it. It's Chicago's Morning Answer on AM 560. The Answer.
This is attorney Stephen Leahy. This isn't the first crisis we faced together. Back in '08, business professionals in trouble sought help from bankruptcy attorneys, loan modification attorneys, foreclosure defense attorneys, and IRS attorneys trying to gain full financial recovery. They should have just called me.